Good morning, older adults of Woodbridge Township. Welcome to our Medicare conference. I am Michelle Morgan, Director of Senior Services, and it is our absolute pleasure to bring to you another conference so that you can be informed and make educated decisions. Fall is the time for Medicare enrollees to review and select 2024 coverage. Medicare open enrollment started October 15 and ends December 7 in order to allow you an opportunity to compare all your coverage options. Today we have a very exciting panel of presenters. We have Mary McGeary, Director from the State Health Insurance Assistance Program. We have Dr. Dara Cass, the Regional Director from the U.S. Department of Health and Human Services. Charles Clarkson, Project Director from Senior Medicare Patrol of New Jersey. Our own Melissa Krublet, Licensed Social Worker for the Division on Aging. And we have Latoya Little from the State Department of Human Services Program Specialist. At this time, I would like to introduce our mayor. He is the vision, he's the guide, he's the support that allows this department to offer these kinds of conferences and offers us an opportunity to bring to you the information that will allow you to live in our community with dignity and independence. Mayor?
Good morning, Woodbridge. How is everybody today? So, I feel like after I'm done up here, I'm going to go sit in the audience because I just turned 65 in May, and I am getting bombarded with Medicare stuff in my mail. Every day, someone wants to offer me a Medicare Part A, Part B, supplements. I don't know what all this stuff is. I'm still working. Although, if I don't win the election Tuesday, I might need to go on Medicare because I'll be retired January 1st involuntarily. And that's not good, is it? No. Heck no, heck no. I just want to say how proud I am of our Department of Senior Services and the job they do. They had a wonderful conference on fraud not long ago. Now they have this on Medicare. It's all filmed, even the people who can't make it out, and we have an awful lot of people that they serve that can't get to places like this for conferences like this, the homebound, that they serve all the time. So this is just so important that we keep our seniors informed so you know how to plan the rest of your life, because Medicare is such a big part of that. So I want to thank and recognize our department director, the great Michelle Morgan. Let's hear from Michelle Morgan. We have Renee Santos, her admin assistant, Cynthia Ruzic, who runs our senior centers. I'll get there. She's telling me what to do. Allison Wisniewski, who is our head of our social services. We have Dawn Davis, we have Kristen Lorenzen, we have Colette, we have Melissa, we have Jody, we have Judy. Did I miss anybody? They're all here. Let's hear for the great staff of the Department of Senior Services. We have the host, the head of this senior center here, Hank Heidacker, his assistant, Billy. We have our health mobile outside. Please stop by and get anything you want checked, or just talk to the registered nurse out there about anything you want. So we care about you, and we appreciate you coming out here today, and I want to thank all of the presenters and all of the speakers for being here in Woodbridge Township. Thank you all very much.
Before we begin, if we could please do the Pledge of Allegiance. If you can stand, please do so. If not, that's okay. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all. At this time, I would like to mention that here at Maple Tree Senior Center, our coordinator, Hank, is having a AARP self-defense driving course scheduled for November 17th. You can see him if you would like to enroll. He is also hosting a luncheon titled Disney Lunch on November 29th. And Maple Tree Senior Center has also begun a Pinochle Club, and we are looking for members. At this time, I would like to introduce Allison Wisniewski. She is the division head to the Division on Aging. She is a leader of that division and is instrumental in coordinating this conference. Allison.
Thank you, Michelle. Good morning. Thank goodness you have your coffee. I was stressing. So, everyone's happy about that. So, welcome today, everybody, to our Medicare conference. I'm Allison Wisniewski, and I have the privilege of leading an awesome staff of secretaries and licensed social workers who are also SHIP counselors at the Woodbridge Township Division on Aging. I just wanted to start with some housekeeping stuff. Please turn off your cell phones or put them on silent or vibrate. If you do have to take a call, if you could just kindly step outside. Bathrooms are to my right, your left, over there through those double doors. But we are taking a short break around 11:15 as well, okay? I want you to take a look at your folders. I know a lot of you have been in there already. You have a nice notepad that you can take notes, write down questions. You will also have a schedule of today's events. And then you will also have two evaluations. So one is our Division on Aging seminar evaluation, so that you can put what you think about today's program and any suggestions or comments that you may have. The other one, it's green on top. That is a survey from the Middlesex County Office on Aging and Disabled Services. So this survey is really great because it gives the county an idea as to what is needed from the older adult population. And I have to say that I think that they do really pay attention to these surveys because I'm noticing over the years a lot of new programs being offered by the county as well. Also, too, you have a really nifty tool, the File of Life, in your folders. A lot of you may already have one, but it's not a problem to get another one because if you open it up, what it is it's a place where you can write down your doctor's information, your medications, emergency contacts, all the information necessary just in case there happens to be an emergency and the EMS might have to go to your home, or an adult child or a friend, somebody can just easily see this and grab it. It has a magnet. You can put it right on your fridge just in case of an emergency. It's also really great to take to the doctors because you know when you go to the doctor, a lot's going on. You have everything right there. Here's my list of meds, good to go. So I just wanted to draw your attention to that. Completed surveys can go in the back. At our Division on Aging table. Right now, Melissa's sitting there, but there's a basket and she's waving her hand. Thank you, Melissa. And there's a sign that says surveys here. Okay, so that was that. All right. Okay. So before I introduce our first speaker, I'd like to say some thank yous. First, a big thank you to the mayor for his continued support for senior services in this township. My director, Michelle Morgan, for her continued support, encouragement, and leadership. My secretarial staff, Jody Snyder, Dawn Davis, and Michelle Despodo. They handled all of the details and all the background stuff to make this event truly great, from distributing the flyers, marketing, taking the RSVPs, calling you, hey, are you coming? Ordering the food, assembling the folders, and so much more. They are a really crucial part to this conference today. Thank you to Renee Santos, Administrative Assistant to Director Morgan, for always willing to help us out. Henry Heidecker, thank you for all your support and help with setting up the room for today to ensure smooth operations. And of course, thank you to my social work team, Julie Hackler, Melissa Krublet, Colette Curry, and Kristen Lorenzen. So not only, yes, give them a round of applause, please. Thank you. So not only are they licensed social workers, but they are also trained SHIP counselors. to provide you with unbiased and comprehensive information about all of your options for Medicare. We are here to help you navigate the maze that is Medicare and give you all the tools and knowledge to make the best decision possible for yourself. And that brings me to introduce our first presenter, Mary McGeary. And before I read her bio, I'd like to thank her. I've been doing this for 10 years as a social worker and SHIP counselor, and I do have to say that she really has prepared us over the years to be great SHIP counselors. We are constantly getting information all of the time, the most up-to-date information, because as you know, things are always constantly changing. And honestly, she has made it much easier for us doing intricate charts, and we just have felt so prepared in order to be able to help all of you. I can email her and she'll give us a response and get us, the answer to our question. So I really, truly appreciate her and all that she has done for the SHIP program for the whole state, actually. But we're very lucky in Middlesex County to have her. So Mary McGeary. Mary is the director of the State Health Insurance Assistance Program known as SHIP in the New Jersey Department of Human Services, Division of Aging Services. She has worked with SHIP since 2005, where she oversees funding and training of over 400 counselors statewide. We are 5 of those. Mary is a graduate of Rutgers State University with a master's degree in social work. So without further ado, I would like to introduce Mary McGeary. Thank you.
Good morning, everyone. Well, I'm a little short, so I don't hope you can see my head over the podium here, but it's my pleasure to be here today to welcome you to this fantastic conference that the team at the Woodbridge Office of Aging Services has put together. Allison stalled half of my speech, so I'm going to be off. But she did ask me to talk to you first about, what is SHIP. And SHIP stands for State Health Insurance Assistance Program. So I'm sorry to disappoint you, but SHIP is not a cruise line. So if you're hoping I'm talking about cruises, that's another day. As Allison mentioned, we do have trained SHIP counselors here. The SHIP program helps you navigate through the Medicare program in an unbiased way. They're not licensed insurance agents. They're not trying to sell you any one product over the other. They're there to help you understand your choices so you can make an educated decision. So, Mr. Mayor, when you are ready to enroll in Medicare or decide when to do it, please make sure you call the ladies at the Office on Aging. So the SHIP program is actually funded by the federal government. The same agency that oversees Medicare funds the SHIP program. And they fund it because they would like you to have someone locally that you can call to ask your questions with. Not sit on the phone at an 800 number and have a wait time of a half hour or more, but someone locally that you can call that lives in the area where you live and can answer your questions and take the time with you to help you understand what your options are. Our SHIP counselors undergo a rigorous training process. They undergo hundreds of hours of training and also a written exam in order to be a certified counselor. So they want to make sure that they give you that up-to-date information. We train the SHIP counselors not only about Medicare, but all the other parts of Medicare, things like supplemental insurance, Medicare Advantage plans, Part D plans, and all the programs that are available to help you save money on your health care costs. You're going to be hearing about some of those programs later on the agenda, about those programs to help you save your money on your Medicare. Now, here in Woodbridge Township, you are very fortunate to have 5+ certified counselors. They're all experienced in all of those aspects of Medicare. Michelle Morgan started as a SHIP counselor back when I started with the program in 2005. And Allison, Julie, and Melissa have 10 years plus experience. And then Kristen and Colette joined us a few years ago. These are very dedicated staff members with your Division of Aging. And just in the last 12 months alone, they have helped over 800 people with their Medicare issues here in Woodbridge Township. And that is just an amazing number for a township office. I'm very impressed and very fortunate that you're here to help with so many situations with folks. How many of you here have got your Medicare questions answered by the Office of Aging staff? Okay, only a handful, so I'm so glad the rest of you are here today to learn about the wonderful things that SHIP can do. Some of the common questions they get are things like the mayor said, I'm turning 65, but I'm still working. Do I need to enroll in Medicare? Or a question like, my husband passed away last month and I'm losing my health insurance from him. What can I do? Or maybe a question like, my doctor gave me a new prescription that cost over $200. I can't afford that. Is there some help for me? Or maybe a question like, my mother was in the hospital earlier this year and I have all these bills coming in. Can you help me figure all of this out? Your SHIP counselors can help you with all of these questions and much more. So as you know, we are in Medicare's annual open enrollment period. You're probably getting lots and lots of packets in the mail, not only from your current policy, but from lots of other insurance companies trying to get your business. You're also seeing many celebrities on TV commercials, including a famous former football player named Joe, who's telling you about you are missing out on important Medicare benefits and to call this number now. So all of this is probably leaving you very confused and overwhelmed. Okay, and our local SHIP is here to help you with all of that. You have a start by attending today's conference, which is a great way to learn the facts about your Medicare options. And as part of that education, I want to talk about the most costly mistakes you can make as a Medicare beneficiary. Number one, not enrolling in a Medicare drug plan because you don't take any medications, or you can get your medications for just $4 at the ShopRite. This is a mistake. The mistake could cost you hundreds of dollars, because if you take an expensive medication down the road, you're not going to be able to enroll in a Medicare drug plan until the next open enrollment, and when you do, you'll have late enrollment penalties. So if you don't have Medicare coverage now or any other type of coverage for prescriptions, make sure you enroll before December 7th. Number two, not comparing plans every year because you're happy with your current one. This also could be that you are losing money. Many of our prescription plans are increasing their premiums for 2024. In some cases, you're paying double what you're paying now. It could be very worth your while to compare the 21 plans available to find something else. Number three, not checking if your drug plan has a preferred pharmacy. All of the Medicare drug plans have lots of pharmacies you can go to, but if you use their local preferred pharmacy, you could save $10 or $20 per prescription. So make sure you call and find out what the preferred pharmacy is. Number four is paying full price for a medication because your pharmacist told you your plan doesn't cover it. All of the Medicare plans have an appeal process for you or your doctor to call. Usually it's just a phone call or a one-page form to get your drug covered by your plan. So use your appeal right to get the coverage that you need. And lastly, number five, enrolling in a plan because someone told you it's better. I often ask people, well, how is it better? And they answer, I don't know, it's just better. Right? So you need to ask the questions of any new plan you're considering. You want to ask, are my medications covered? Or the doctors and the hospitals I like to use in the network of the plan? What are the co-pays I have to pay if I have to go into the hospital or need an MRI? If the plan's offering dental benefits, find out the details of that. Are they just going to cover a routine cleaning or do they cover something more comprehensive? So be a savvy consumer. Ask questions before making plan changes. And if you need help with those questions about Medicare or any other type of insurance that works with Medicare, call the Woodbridge Department of Senior Services. There are 5 wonderful and experienced counselors there. They're very friendly and very eager to help you. And please tell them that Mary sent you. Okay? Enjoy the rest of the conference.
Oh, you can sit right there.
Our next presenter, Charles Clarkson, since 2005 has been the project director of the Senior Medicare Patrol of New Jersey under the auspices of Jewish Family Services of Middlesex County. The Senior Medicare Patrol of New Jersey is a federally funded program of the United States Administration for Community Living and part of the National Senior Medicare Patrol Project. There is a Senior Medicare Patrol in each state, the District of Columbia, Puerto Rico, Guam, and the U.S. Virgin Islands. The Senior Medicare Patrol of New Jersey is responsible for teaching recipients of Medicare in the state of New Jersey to become better health care consumers. As part of this effort, seniors are provided information to prevent them from becoming victims of fraud, waste, and abuse in the Medicare program. The Senior Medicare Patrol program also assists beneficiaries in reviewing suspected Medicare fraud and can act as an advocate to assist beneficiaries in fighting Medicare fraud, waste, and abuse. Mr. Clarkson is a New York attorney who for many years was Vice President, Deputy Counsel, and Corporate Secretary of TLC Beatrice International Holdings, a multi-billion-dollar international food company. Mr. Clarkson, it's a pleasure, always.
Okay, good morning, everyone. Again, my name is Charles Clarkson. I am the project director of the Senior Medicare Patrol. As she mentioned, every state has a Senior Medicare Patrol. And by the way, feel free to interrupt me at any time for your questions. I'd like to make this somewhat interactive. So I'm also a New York attorney, and people ask me all the time, how did you go from being a New York attorney to the New Jersey project director? Well, here's a true story. You know, in the year 2000, I was general counsel to Beatrice Foods. Many of you are old enough to remember Beatrice. It no longer exists, but it was a very large food company. And the company was sold in 2000, and I was out of a job. And I said to my wife, don't worry, honey. I'll just take off a year and go back to work. Well, I never went back to work. 5 years go by, I'm helping to raise my 2 children, and my wife is elected president of the Jewish Family Services. One day she came to me and she said, honey, and I knew I was in trouble. She said, honey, I have a grant at the agency called the Senior Medicare Patrol, and the project director just quit. You know, you're not doing anything. You should take that job. I said, what are you talking about? I don't know anything about Medicare or Medicaid, and I was much too young. Then she said one more thing to convince me. She said, honey, you're driving me crazy. Get the hell out of the house. So here I am, out of the house. Okay? So let's talk about Medicare fraud, waste, and abuse, and what you can do to protect yourself. First, I'm going to start off with a question. How much money do you think Medicare loses in 1 year to fraud? Billions, yes. And you know how much? 60 to 80 billion a year. And who's paying for that? Coming out of your tax dollars. So you have to do whatever you can to protect yourself from Medicare fraud, waste, and abuse. And my job is to help you do that. Okay? I'm going to ask you another question. How many of you right now are carrying your Medicare red, white, and blue cards? Do not carry your Medicare cards with you. I'll tell you why not. Leave them at home. You can take it with you when you go to the doctor, when you go to the hospital. Otherwise, leave it at home. You don't need it. And people always ask me, oh no, what about an emergency? Well, here's a scenario that might sound familiar. You're driving down the New Jersey Turnpike, you're in an accident, and you're rendered unconscious. What's going to happen? The ambulance is going to come, the police are going to come, and they're going to transport you to the nearest hospital. Do they check you to see if you have medical insurance? Of course not. You don't need to carry the card. But no matter how many times I'll tell you this, I know you're gonna still carry the card. Okay? Because you always ignore me. Okay? So here's what I suggest. If you have a smartphone, take a picture of it. Because you have an ID or a fingerprint, and at least the phone gives you some protection. If that doesn't work, take a picture of the card and put it on your phone and cross off a number of the letters before you take the picture. That will help you keep it safe. Now, when I say leave it at home, put it in a safe place. What that means is don't hide it where you can't find it. That doesn't help you, because you may need to take it if you're going to a new doctor. Remember, I go to my doctor, right? He already has my Medicare information on file. My local hospital has my information on file. I don't need to carry the Medicare card with me. It's really not necessary. And the number one reason people are cheated is because their Medicare card is lost, stolen, or copied. So really, you have to protect yourself. Now, you know, 5 years ago, they changed the Medicare cards, right? You all got to know. What changed? Right, they took off the Social Security number and added the new Medicare beneficiary identifier. We still call it the Medicare number, okay? They did this to fight fraud. Because in the old days, if you were compromised, you could call up Medicare, but they would send you a new card and the same Social Security number. How did that help? It didn't. Now, just like a credit card, if you have a credit card and you lost it, what would you do? You'd call up and they would give you a new credit card with a new number, right? We can now do that in Medicare. So if your number is compromised, we can actually give you a new Medicare beneficiary identifier. So you don't have to have the same number that people are using to cheat you and Medicare. But people don't realize this. So if you ever believe your number is compromised, you have to call up Medicare. I can't do it for you. You have to do it personally. And say, my number is compromised. I want a new number. And if they give you a hard time, who are you going to call? Me. Right. We're the Senior Medicare Patrol. You can call us. I'm going to give you our Jewish Family Services number. And you can call us any time. We're free. And we are federally funded, okay? So the number is 732-777-1940. You can ask for me, Charles Clarkson, or just ask for the Senior Medicare Patrol Program. So let's ask another question. What are the 3 most common frauds in Medicare? Anybody want to guess what the number 1 fraud is?
Doctors billing for services you don't get.
That's right. Billing for services never provided is the number 1 fraud. Anyone else? So how do you know that you're being cheated?
You look at your sheet. I compare when I get the
Right.
notification from Medicare, what the
Well, you
service.
should come up here and give this lecture. You know all the answers. This woman knows all the answers.
I compare my calendar, what doctor I went to, what services, and what they're charging.
Very good. Okay. Now, in our back table, we remind people, keep a tracker. I don't care what calendar you use. We happen to have a convenient one that we print. Look, someone is holding it up right there. Thank you very much. Okay? Every time you go to the doctor, you write it down. You take a test, you write it down. Why? When you get your statement from Medicare or from your Medicare Advantage plan, remember Medicare summary notice, and a Medicare Advantage plan, you get an explanation of benefits. You want to read that carefully. Guess what? Statistics show that less than 5% of you ever read your statements. And if you don't read your statements, they're going to get away with it. Because you don't report it. And Medicare doesn't know it's fraud. How do they know? There are 65 million of you on Medicare. Unless you report the fraud, they have no idea. Number 2, upcoding. That's where the doctor charges more than the service he actually provided remember, when the doctor does a service, they submit codes to Medicare, either through their own office or a billing department that they send the claims to. I'm going to give you an example. So I fall and I hurt my wrist. And I go to my doctor, and he says, Charles, you know, I think it's broken, but it's so swollen, I can't tell. Go get an x-ray. So I go get my x-ray. But when they bill Medicare, they bill for a CAT scan. They don't bill for an x-ray. But they bill for an MRI, they don't bill for an x-ray. The higher the code, the more money they get paid. It's incumbent upon all of you to read your statements carefully, okay? And keep a calendar. That is very, very important. So I'm also going to talk about scams that we are currently seeing in that, oh, I didn't say the third. The third is double billing. And people always stop me and say, Medicare's got to know it's double billing. They're getting the same claim twice. Well, here's the problem. What if you're on a chronic condition and you're going to the doctor every month for treatment? It's going to look the same. It's going to be the same. Does Medicare know if it's being double billed? No. You have to tell us. So if you read your statements and you think you've been double billed for the same service twice, either you report it to Medicare or you report it to me, the Senior Medicare Patrol. We have 30 to 40 volunteers that we have trained, and they are assigned to your case, and their job is to help you fight the fraud, waste, and abuse. Of course, we want to prevent it. That's why I'm here. We want to prevent the fraud. That's why you have to protect your Medicare number and Medicare card at all times. Also, another rule. When you get a telephone call and you have a pad that says the number that's calling, and if you don't recognize the number, do not pick up the phone. And when your sister calls like mine and I recognize the number, I do not pick up the call. Because I don't want to speak to her. So it's a win-win. How can you go wrong? Now, what you're going to find is this. When you get telephone calls and you don't pick up, and you shouldn't, most of the time they don't leave a message. So you know it's not. It might not be a scam, but it's a solicitation of some kind. And when they leave a number, if they do leave a message, like they said earlier, don't use that number. You look it up yourself and make sure you're calling the right number. So if you get a call from Social Security, by the way, Social Security will never call you, and they leave a number and it sounds legit, don't use that number. You look up Social Security and you call them directly. You ask them, is this a scam or did you actually call me? And by the way, the rule is this. The IRS, Medicare, and Social Security do not call you on the telephone. Okay? So if you get any of those calls, if you happen to pick it up, you slam the phone down. We call it slam the scam. But you shouldn't pick up in the first place. You don't realize that every time you pick up, you're going to get more calls. Because remember, these calls are computer generated. You think there's somebody sitting there dialing thousands of calls? No. There's a computer program that's doing it, and when you pick up, someone live. Let's talk to them, see if we can scam them. Okay? So try not to pick up the phone. I know it's hard. Yes?
You reminded me.
Hold on.
You reminded me, I had gotten this in the mail from Press Gaming, and what it is a survey for Medicare. And I didn't fill it out, and I said, wait a minute, how do I know this is Medicare?
Absolutely. You know, she said basically she got a card, which is a survey supposedly from Medicare. Let me explain during open enrollment what's happening to you, okay? Medicare Advantage plans are very profitable. And people don't realize, how can they offer these additional benefits that Joe Namath or J.J. Walker or Captain Kirk are offering? How can they do that? Because every month you're in a Medicare Advantage plan, that your government is paying them a certain amount of money based upon your being in the plan. That could be anywhere from $1,000 to $1,500. If you are high risk, they actually get paid more. So if you don't go to the doctor any month, do they have to return the money? No. Medicare Advantage plans are extremely profitable. And many insurance companies that are offering them have been accused of upping the risk scores of their beneficiaries in order to get paid more money. Okay? So Medicare is a complicated, difficult program. And fraud abounds all over. Now, I was going to talk about scams, and I want to tell you the number one scam we are currently seeing. COVID-19 home test kits. Many of you are getting delivered them without ordering them. They're not medically necessary, and yet Medicare is paying for them. If you did get COVID-19 tests in the mail and you didn't order them yourself, please call my office and let me know. The Senior Medicare Patrol, we are tracking this scam because it's happening nationally. And we lose billions of your dollars going out to scam artists, which could be used to pay for real medical services. Okay? Number 2 scam, genetic testing. If you get an email or a text or a telephone call saying your doctor has ordered a genetic test because he wants to find out how to better treat you, and if he has your genetic makeup with the protocols, he can determine how to better treat you. Scam. Do not fall for that scam, okay? That is a big scam that has been going on for years. And again, please report it to us so we can keep track of it. And then, of course, durable medical equipment. Knee braces, neck braces, back braces. All of a sudden, you get a box in the mail and you open it up, and all these braces are there. You didn't want them. They weren't approved by your doctor. A sign that your number may be compromised and someone is using it to send you the equipment and sell your number to other parties. By the way, look, this is the internet age, right? When you go on the internet and you put your personal information, we're all at risk. There is risk involved. When you want to avoid these risks, never go on the internet. But do you want to live like that? No. I want to pay all my bills on the internet. I don't have to buy stamps, I don't have to buy envelopes, and the bank does it for me. But they have my personal information, right? If my bank is hacked, there goes my personal information, including my social security number, my address, anything about me that I had to fill out with my bank. Somebody had a question, yes?
Okay.
Well, hold on.
Not a question.
Speak louder into the mic.
I'm on CPAC, and I get the solicitation all the time to get my supplies, and I haven't gotten any. I got a bill, and I haven't, and it says for the end of September, and I did not order anything.
Yeah,
I
yeah.
didn't pay it.
Good.
Um,
Did you call me?
No.
No. See, there's the problem right there. You have to call me.
But should I tell my insurance company?
What was that?
Should I tell my insurance company?
I would, certainly. I would call Medicare, I would call your plan, and I would report to them. If they don't cooperate with you, or you don't think they're doing a good job, who are you going to call? You. Me. Thank you very, very much. Listen, we're all in this together. Medicare fraud is taking money out of your pockets and using it for purposes that don't help anybody. And the fraud keeps growing. Keeps growing. You have to read your Medicare summary notices, your explanation of benefits, and you have to read them carefully. I don't want you to look at the bottom. You know, the Medicare summary notice says this is not a bill. Well, treat it like a bill that you're not paying for. And if you see something on there that you didn't get, or you question, please report it to the Senior Medicare Patrol Program. We're free. We're not selling anything. We just want to educate you about fraud. Also, we do presentations like this all across the state of New Jersey. So if you belong to a senior club, a senior group, a church, a synagogue, any place that seniors gather, we'll come and do a free presentation for you. And I'm a funny guy. You know? So, why wouldn't you invite me? Okay? Somebody had a question over there.
Good morning.
Good morning.
I had my eyes done a few months ago, and I received a bill from the office saying I have to pay for the anesthesia. So I went to see my doctor on Monday, but he wasn't there, but I spoke to the lady, and she said, call, but I had it in mind to call, but I wanted us to go over it with my doctor. So I called, and the lady on the phone, she said, well, it was this amount of money, and then it was this amount of money. And if I don't pay, she's going to put it to collection officer. So I said to her, I have a collection officer right here. So I went to my daughter and I gave her the phone, and she spoke to her.
Okay.
And she asked her certain questions about if she got any information from certain. And she sent it to her on email, and she checked it out. I don't owe any money.
That's right. Listen, so if you ever get billed for services that you didn't know you didn't get, don't pay the bill. Please, don't pay the bill. Call us, let us help you. You know, why would you pay a bill for a service you know you didn't get? You should always report it. By the way, our 3 words are protect, detect, and report. So in order to detect this fraud, you have to read your statements. And a lot of you I know don't, because it says you owe no money. Well, that doesn't mean anything. There could be other things in your bill that's being paid for by Medicare. So really, take the time to read your statements. I know it's hard. And if you belong to a senior club, please invite us. We're not selling anything. All we want to do is educate you about fraud, waste, and abuse. So unless anybody has any other questions, I guess you want me to end it with another joke?
Yeah.
Just a second joke. Okay. A man and woman live in Florida at a complex senior, area. And they start dating. Both of their spouses have died, so they start dating each other. And after a couple of months, they fall in love. And they decide to get married. They're in their 70s, by the way. One day they're walking into town, and they pass the pharmacy. And the guy said, let's go in and talk to the pharmacist. The woman said, okay. So they go into the pharmacy. The man behind the counter, the gentleman says, oh, are you the pharmacist? The gentleman said, yes, I am. I also own the pharmacy. How can I help you? Well, do you sell erectile dysfunction drugs? Yes, we do. Well, do you sell walkers and wheelchairs? Yes, we do. Well, how about diapers for seniors? Yes, we do. The gentleman says, look, we're a big pharmacy. We sell everything. How can I help you? Well, this young lady and I are planning on getting married, and we want to add your pharmacy to the gift registry. Thank you very much, and have a wonderful day.
Hold on, there's just one more question.
That's a good question.
Oh, you got it? Okay.
Good morning.
Speak loud.
Are you only servicing this area, or are you for all of New Jersey?
No, we cover the entire state of New Jersey. Remember I said every state has one senior Medicare patrol program? I run the one for the state of New Jersey, so we'll go to Cape May, all the way up to, and in the back there, Joel Snyder, raise your hand, Joel, the ugly guy with the white hair, okay? He's our outreach specialist. He and I do a lot of the presentations, and he thinks he's as good as I am, but you're better off asking me, okay? Hold on, what was that? Oh, my phone number again is 732-777-1940. It's the Jewish Family Services. Don't let that throw you. You just ask for the Senior Medicare Patrol Program, okay? Thank you and have a wonderful weekend, everyone.
Thank you, Charles. Our next presenter is Dr. Dara Cass. She is the Regional Director for Region 2 from the United States Department of Health and Human Services. Dr. Cass is a graduate of SUNY Downstate College of Medicine and the Kings County Hospital Emergency Medicine Residency. She began her career in resident education at Staten Island University Hospital, followed by medical student education at New York University School of Medicine, and most recently was an associate professor of emergency medicine at the Columbia University School of Medicine. A champion for gender equity and the advancement of women in medicine, Dr. Cass's academic work has focused on creating a more equitable workforce for women in medicine. Prior to working at the United States Department of Health and Human Services, Dr. Cass focused her work on public and policy and public communications regarding the COVID pandemic. She has focused her communication on the impact of COVID on communities and families, empowering Americans to make informed decisions for themselves and their families. As Regional Director, she works to advance the Secretary's priorities and convenes local stakeholders, particularly with respect to reproductive rights, mental health, expanded Medicare benefits, among other initiatives. The role also entails public-facing messaging via mass and social media to reach the more than 30 million residents served in the region and beyond. Region 2 is based in New York City and serves New York, New Jersey, U.S. territories in the Caribbean, and several federally recognized tribal nations. Dr. Cass, welcome.
Thank you so much. And thank you for having me. So normally I am the funniest presenter on Medicare, and I'm already feeling imposter syndrome because I came in to what was really a very extraordinary presentation. So I gotta say the bar is very high. So I am Dara Cass. I'm the Regional Director of the U.S. Department of Health and Human Services. I'm also an emergency medicine physician, like my way too long bio preceded me for. So what I'm really here to talk about is a couple of things. I'm here to talk about, normally I ask how many of you have Medicare, right? And everyone's hand goes up, because that's literally why we're here. And I've been going around senior centers and community like clubhouses and all over New York and New Jersey talking about some of the new Medicare benefits for senior citizens who have Medicare, specifically Medicare Part D, but really doing it in a way that answers questions that you'll have around what's going on. Now, we know it's currently open enrollment, which is why we're having, I think, this whole event today. And so open enrollment goes between October 15th and December 7th, and it's a real chance for you to make sure that the program you're enrolled in is the right program for you. So one of the things that I actually included in this, and you'll see there's a lot of people in the back with information, is actually the federal program for the SHIP advisors, which is the phone number for the nonpartisan, non-employed people who help figure out if the programs that you're enrolled in are the right ones for you. I know a lot of you watch television like I do, and there has been an influx of commercials over the past 2 weeks about how many programs there are out there to service people that have Medicare. I say often, Joe Davis was a great football player. I'm not so sure that I would ask him which Medicare Advantage program I should enroll in. And I think that that's part of the conversation we need to have here, which is that every program out there may be right for you, but it may not. And you need to get advice from people whose job it is to give advice, to make sure that you're not being sold package of goods that's not perfect for you, because there will be a program perfect for you. On the other side, I wanted to go over some of the, what we call provisions, so some of the stuff that's in the new Inflation Reduction Act. So raise your hand if you've heard of the Inflation Reduction Act. I love that, okay? That's actually a pretty good percentage of the room. So the Inflation Reduction Act was passed at the end of 2022, effective 2023, and it was a, what I call a unipartisan piece of legislation. But it had effects for every American senior, okay? And so what was in it, there was a lot of stuff in it that's not related to Medicare. There was some climate, the largest climate bill that was really ever passed. It had some tax provisions. But what it really had, which is important to this room, is benefits for people who have Medicare and other health insurance benefits, specifically around Medicare Part D, which we know is the federal prescription drug plan, okay? So we're going to go through a few of those. So stuff that's already gone in place, effective January 2023, all right? The $35 insulin provision. Now, raise your hand if you know somebody who has diabetes, who's a senior citizen on insulin, right? So 40,000 seniors in New Jersey take insulin as part of their treatment for diabetes. Now, many seniors who have diabetes take other medications. When I first started doing this, when the law first passed in January and February, people would ask me, well, what about me? I don't take insulin, I take another medication. And we're going to talk about that in a second. But if you're on insulin and you have Medicare Part D, and it's actually Part B, $35 a month for covered insulin per prescription. Now that's already got in place, and you're seeing savings across the board, okay? The other part of this that went into effect in January 2023 was the vaccine provision. We're going to do a little game. How many of you have gotten the shingles vaccine? Please raise your hand. Now keep your hand up if you paid more than $1 for that vaccine. Okay, keep your hand up if you paid more than $50 for the vaccine. All right, now I'm going to do my game. How much, if you don't mind me sharing, how much did you pay for the vaccine? $25. She paid $225, okay? And the reason I do it in every single room, whether it's 12 seniors or 150 seniors, is many seniors don't realize that there are your friends, your neighbors, who have been paying over $200 for the shingles vaccine. Now, for many of you that had the shingles vaccine, it is not so fun sometimes. Side effects can be pretty, uncomfortable, but to have to pay for that with an additional $200 is even worse. And in the Inflation Reduction Act, it says that every vaccine that is a preventative vaccine is now no cost to seniors. So we're going to go over what vaccines that is, right? So we now know that includes shingles, right? What other vaccines do you think it includes? COVID, flu, RSV. I wonder if you're getting it next week. We'll talk about that in a second. RSV, pneumonia, tetanus. Okay? So we're going to talk about tetanus for 1 second, we'll go back to RSV, and then we're going to go back to COVID. Tetanus boosters. Many people have to get a tetanus booster when they have a grandchild, because the other part of it is the whooping cough vaccine. Does that make sense? So you get a grandbaby, your daughter-in-law, I'm a daughter-in-law, so I can say this, looks at you and says, you can't see the baby till you get a new vaccine that's going to cost you $150, right? Now this vaccine is free, okay? Because it's really important that seniors stay up to date with their vaccinations. And many of you were not paying for your vaccines, right? And you didn't know that there was a gap for people who needed to pay for certain preventative vaccines because they weren't covered either by the program that they were on or the supplemental program that they had. So the average senior in New Jersey is saving somewhere between $60 and $70 a year just by the vaccines alone. In some other states in the United States, you can save up to over $100 to $130 per year on the vaccines alone, okay, on average, right? The thing about this bill is it's for every American senior who has Medicare. But because of where we live, the impact is not actually the same for all of us. Here in New Jersey and in New York, the two states that I go to, the impact is actually lower for a lot of seniors than people that live in other states, like Idaho and Wyoming and South Dakota. because they were actually paying more money for some of their drugs and some of their vaccines in the seniors here, right? One of the things I do is I travel around talking about what states you live in versus what the federal government does, and what state health agencies can do to help you stay safe and healthy. And I think sometimes we need to remember that here in New Jersey, the Department of Health, the executive branch, spend a lot of time trying to keep seniors healthy. You're seeing what's happening in the back. Many of these are New Jersey state programs. And so it's really important to remember that your state here is working really hard to keep you safe and to keep you healthy, but that this bill, which is federal, kind of elevates the floor for everyone in the United States. Okay? So that's insulin. There's a very complicated part of this that ties the rising costs of certain drugs to inflation, and I'll just say it like this. Who here thinks that drugs are too cheap? Right? And who thinks that inflation is too low? So the way this works is if a drug gets higher, if the price rises higher than the rate of inflation, it has to come down immediately. And there's a benchmark for that. And when the drug price comes down, it's not a huge number of medications and not a huge number of seniors are affected by this, but the ones that are, when the price comes down, and it's already come down for dozens of drugs, two things happen. One, the pharmaceutical company has to pay a rebate to the Medicare trust. Does everybody know what the Medicare trust is? No. The Medicare trust is what keeps your Medicare alive, right? It is the big kind of, that's where your funeral taxes is on, so all of the things that you've been paying into Medicare go for your whole life. And when people say we're running out of money for Medicare, what are they talking about? They're talking about that trust and the amount of money it's going to have to pay for seniors going forward. So when penalties go back into the trust, they may not be rebates to consumers, but they are helping keep all of Medicare afloat. Does that make sense? The other thing that happens, and I ask these questions a lot, how many people here know somebody that goes to the pharmacy and pays $300-400 for one prescription? Right? What happens if the price of that medication comes down? What happens to the amount of money you pay at the pharmacy? So that's $300 or $400. It actually comes down. That amount of money, that what we call co-insurance, right, is actually a percentage often of the cost of the medication. And the reason I bring that up is when you hear about prices of medications coming down, which includes the negotiation, we're going to talk about in a second, that will bring the price for many of those medications down for people at the actual pharmacy. All right? So there are senior citizens right now, because of this smaller part of this law, that are seeing their price at the pharmacy come down for a specific medication that got too expensive, higher than the rate of inflation. All right. So now on your paper, the next thing we talk about is the $2,000 out-of-pocket cost. Cash. Okay? Now, on all of the bills, this is the one that I am the most excited about. And I hold on to it kind of until the end because I think it gets distracting because everyone's like, oh, this is amazing. All right? And so we're going to pause for 1 second and talk about another part of the bill, which is the negotiated drugs. So how many of you have seen the list of negotiated drugs that we're negotiating starting now? You've seen them?
Yes, I don't remember.
I remember them. Okay, so let's go back.
was talking about them. Yeah.
President Biden was talking about them, because this is very exciting. That doesn't catch you up. Medicare has not been able to negotiate drug prices directly with pharmaceutical companies until now. Other federal agencies, Department of Defense, the VA, have been able to negotiate drug prices for their customers. Private insurers can negotiate drug prices. But until now, Medicare could not for 65 million seniors, okay? So what's on the list? Now, again, I'm going to say drugs. Has anyone here heard of Eliquis? Eliquis, it's a book business, right? 3.5 million seniors are on Eliquis, right? Have you heard of Xarelto? It's another weapon, right? So these are patients that have had a heart attack or stroke or an irregular heartbeat called atrial fibrillation, right? A blood clot in the leg, right? So this is millions of American seniors are taking this medication, and it's all in with 10 drugs. They're going to save billions of dollars for Medicare when we're negotiating that. Now, who's heard of Januvia or Jardiance? Right, so diabetes. See, the commercials work, right? I mean, that's the thing. Why do you know what they're for if you're not taking them, right? So it is true that a lot of these medications are the same ones that you have seen on television, right? So when you're diabetic, if you're a senior citizen with diabetes who is on Medicare Part B, your $35 insulin may make your costs come down. It's critically important that you get vaccinated, right? Because we know patients with diabetes are at higher risk for infections, right? And now for Zargate for Januvia or the Flex 10 for Nola, you know, these are medications that are on the list that we're negotiating, right? Other medications on the list affect cancer, heart failure, kidney disease, autoimmune diseases like psoriasis and Crohn's disease. And there's many, many ways that this list represents the future. So in the law, there was a lot of ways this list had to be generated. Things like how many years on the market, whether there was a generic, whether there was, you know, kind of like a really kind of very specific category that they could start. How many seniors were affected, okay? And the reason I bring it up is because after the first year, so we started in 2023, and the effect of the negotiation will come into effect end of 2025, so January 1st of 2026. We're already going to start the second round of drugs. I see that face. I will tell you why. I will tell you that. I know. I always get that face. So, and then the second round will be in January 2024. They're going to start the second round of drugs, the next 15. People ask me, why is it taking so long? Why can't it just start now? Right? I get every year the lady in the form is like, if I live that long, you know? And I hear her, right? You know, if you're taking your medication, that means you get vaccinated, go for the longer. But the answer is that this is not a mandate. This is a negotiation, right? This is a large customer negotiating with pharmaceutical companies, and in the bill, there are very specific steps that have to happen to respect the negotiation. And so some of the things in this bill don't go into effect until 2025 or 2026. Some of the other stuff went into effect already. But that's part of why this is going to continue to bring down the cost of prescription drugs for seniors continuously and increasingly in the future. It will continue to get better every single year. More drugs will get negotiated, more benefits will be able to be seen by seniors, and that is a really big deal. Which brings me to the $2,000 pocket law, because I think this is the one that's like really exciting. Starting in 2025, once you hit $2,000 in drug costs, you're done. You don't have to pay any more money. Okay? Now, we're looking at open enrollment for 2024, right? And people ask me a lot about the plans they're having and whether or not their prices for Part D are going up. And this is why it's really important to talk to counselors about the individual programs. But once we get into 2025, that $2,000 out-of-pocket cap goes into effect. Yeah.
The $2,000, that's the actual cost of the drug or the copay?
The cost to you. After you spend $2,000, you don't spend any more money. Okay? And again, for some seniors who are on medications that can cost them hundreds of dollars per month, you can get there very quickly. I was in a room the other day with a senior citizen who spent $4,600 already this year on medications. Right? She would already have $2,600 back in her pocket. Right? She would be done, she would have probably finished spending her medication money by like, April or May. All right? And this is a big deal because when you think about the entire package of low-income subsidies, so there are more benefits in here for people that qualify for extra help, right? So you have extra help, you have negotiated drug prices, you have caps on insulin, you have vaccines that are no cost to you, and ultimately you have a protection that says once you hit a certain amount of money out of pocket, you don't have to worry anymore about spending as long as the medication is covered under Medicare Part D. Which means if you find out you have a new diagnosis and you need to add a medication, you don't have to think about where is that money going to come from. Is it going to come from my ability to pay my rent or my ability to buy food? You'll know that if you hit that out-of-pocket maximum, you're done for the year, right? That level of security, when I think about my mom and her limited income. I mean, I don't know if any of you guys are like selling an app to Google or like finding $1 billion extra in your life, but I doubt it. American seniors are generally on fixed incomes and need to know what their expenses are in a predictable way. That's what this does around prescription drugs. Okay? The other thing, which I say a lot here, is it also has some help for the Affordable Care Act. We're also in open enrollment for the ACA, for the marketplace. If anyone here has friends or family that are buying their own insurance in the marketplace, there are more credits to bring that price down. And the other thing I'd like to remind everyone, because I do my job right, is that we are also in a period of redetermination for Medicaid. So many American seniors are called dual eligible, meaning they have Medicare and they have Medicaid, okay? And so if you are in both categories, what's the water? You okay? Please the water? Water, okay. If you're dual eligible, you are not only thinking about your Medicare open enrollment, but you need to make sure that if you get the index card from New Jersey Family Care, I believe, around your Medicaid, you have the information that is correct, so that you are re-enrolled in Medicaid and you don't lose it. When the public health emergency for COVID ended, we had to make sure that everybody that was enrolled in Medicaid was still qualified. And actually, most people who are not qualified for Medicaid anymore will not qualify because they got employer-based insurance when the pandemic ended, or they got a job again and they earned more money. So if you're still on the same fixed income and you had Medicaid, just to make sure your information is up to date. That's also true for children on Child Health Plus. So in your family, at your church, with your friends, wherever you live, make sure that anybody on Medicaid is paying attention to that redetermination card. Their information is up to date, so they don't unnecessarily lose their Medicaid. Okay? And I said something about vaccines. Please remember, it is time to get your vaccine. I think there's a van outside that might have vaccines. Am I crazy? No. It's just clear. Is there vaccines in that van? No. I just blood pressure. Okay. So the van outside is just blood pressure. Check your blood pressure. But also, it is time to make sure that you are up to date for your vaccine. So many of you, that will mean update on COVID, update on flu, and the RSV vaccine. It may be your opportunity to get the shingles vaccine. Whatever it is, you can space them out. You can do one a day. You can do 2 at once. Whatever you feel comfortable with. We are still COVID is around us. Everyone has a different story, a different journey. So please, if it's your time and you know that you're ready, that you are eligible again because you haven't had COVID over the last 2 or 3 months and you did not get the most updated vaccine, it's a really smart idea going into the winter to make sure that if and when you unfortunately get COVID, you are as protected as possible. And obviously the same thing is true for the pneumonia vaccine and for the flu vaccine. Okay? This is when I take questions. Yes?
I wanted to know all those vaccines that you're talking about, do we have to get a doctor's prescription?
No.
You just go to the pharmacy?
Yes, yes. So if you go to vaccines.gov, that will tell you where to get the COVID vaccine. Many pharmacies administer all these vaccines. You just have to make an appointment. But you have your what? Bring your Medicare card. You do not need to get a doctor's note. You don't need to get these vaccines at your doctor's office, although many of your doctor's offices will give the vaccines, but pharmacies, doctor's offices, and then you can also look around. The Department of Health may have clinics as well.
My second question is...
Second question, what about your reporter? It's amazing, I love it.
No, I'm new to this.
I love it.
I just got on, and I just got on this year, and it's time to renew again.
Mm-hmm.
So the gentleman called me the first time, but I'm still not clear, like, what's part A, what's part B, what's part... So I was saying, is there a class?
Yeah, there is
just
today.
for the beginners?
Yeah, today. So to be clear with all of this, okay, so Medicare can be very confusing, all right? So what is A, what is D, what is G, and F, by the way, there are supplemental plans and Medigap that have different letters, and A, B, and D, and C. What is C? It's Medicare Advantage. Who decides to name it that? So let's be honest, Medicare can be very confusing. And deciding what Medicare program is right for you can be hard. And that is why days like this exist. So they're going to go through all of the different understanding the aspects too of Medicare, right? And helping you understand what you need to know. And where your costs may lie, what the premiums will look like, how do you pay for all the different expenses. All of that is what today is about. And then if you still have questions, that phone number in the back of this piece of paper, plus probably every single flyer in the back, will get you the same resources you need to make the right decision for you. The most important thing, I was watching television this morning, and there's a commercial, another Medicare Advantage commercial, with some lady who's like, I don't know what to do, I'm not gonna do anything. Did anyone see that commercial? Right? She's like, it's so confusing, I'm just not doing anything. And I think that's her point, right? And that is the wrong thing to do, right? The reason it's satire, the reason it's a joke is because that is a terrible idea. You deserve to know which Medicare program is right for you. You deserve to know what is most affordable for you while covering the medications that you're on so that you can see the doctors that you need to see. So please, I'm so grateful that you're all here today because this is the first step in knowing that you have the right coverage. But don't put your head in the sand and please lean into this opportunity because we are lucky that Medicare is getting better, and we're continuing to improve it. I am proud to work for an administration that is definitely trying to continue to improve Medicare, and I encourage all of you to pay attention going forward about the Inflation Reduction Act as we announce the next medications, as we announce, all the continued advancements. And if you think this is important to you, remind whoever you vote for, wherever you vote, whatever you do, that this is important because this is a really, really meaningful step to make Medicare better for you in your pocketbooks starting today. Yes, sir.
I will be due for Medicare next February. What I wonder is that you cannot carry on Medicaid and how are Medicare benefits better than Medicaid, because to me it's okay, it's covered so much. And I didn't work here, so I will not be getting any social security, so that's my right.
Okay, so he asked if you have to replace your Medicaid with Medicare. Is that the question? So one of the things I was trying to, there are people that, Medicare and Medicaid are not exclusive. You do not have to give up your Medicaid to use your Medicare. When you transition to Medicare, you will continue to have Medicaid if you're qualified. Those qualifications may be different and what it covers may be different because of what is covered under Medicare. These are really important questions that are very personal often to you and you need to know the answers, but the answers are there. Okay? But what, again, you shouldn't do is not ask those questions because the answers exist and we have them. Okay? Yes, sir.
Can we have Part D alone if we don't have Part B?
You can have Part D if you don't have Part B. Okay, so I am not going to pretend I'm a Medicare counselor. We're going to go through that. I will say it like this. Medicare Part D, it is worth all of you who have not had Medicare Part D in the past to reevaluate if it is worth it for you. Because if you didn't have Medicare Part D in the past, you were often paying out of pocket for vaccines. If you didn't have the supplemental insurance, you were often paying different prices for your prescription drugs. So it may be that even the provisions alone in the Inflation Reduction Act that have already gone into place may make a decision that was not what you wanted to make in the past better now. Okay? That is how I will say that. How and when you can get all the different case evaluations and counselors who will ask more about your particular circumstances and exactly what you already have versus what you're eligible for. All right? Last question.
If I don't do anything at all, I heard that they would just automatically put me back in the plan. Is that true?
I will leave that to them later today to say if you don't do anything, you automatically re-enroll in the plan you have.
Stays the same.
Stays the same, yes. So if you don't do anything, but again, I will encourage you that it is almost always in your best interest to reevaluate. Many of you got notifications that there's a raise of a couple of dollars here or there, and there are other new plans coming down. It is always in your best, like my husband does with the cable company or the internet. He's constantly changing, Hulu TV, YouTube TV, Sling TV. He changes it like he changes, the light bulbs. I would pay attention, and I would use this as an opportunity to figure out if you are qualified for if there's a plan that's a better fit for you and your needs. Okay? All right, I think we're done. Thank you guys so much. Hello. So I'm really glad that these
thank Charles and Sarah. You guys were amazing. Two really great presentations to start off our day. Yes, please give them a round of applause. So I'm really glad those couple of last questions came up because they are really important, and coming up, some of them may or may not be answered, but they will be answered, maybe not today, but maybe later, because we do have all our shift counselors here at the back table. So you'll go back there, they'll take an intake, and someone will reach out to you and talk to you about your very personal situations, right? So, like, for example, you asked the question, can I have a Part D if I don't have a Part B? Well, it's kind of a loaded question, right? Because really it depends on your circumstance. So that's why it's really important to meet with a shift counselor to talk about your individual situation. Because your spouse might still be working, or you might still be working, and that's why you don't have Part B, etc. So that's why it's really important to talk to us. So that's coming up. We're not only going to talk about updates, but we are going to go into what Medicare is, what's A, what's B, what's C, all of that. So that's coming up. What's also coming up is ways to save money on your prescriptions and premiums. So that's also coming up too. So I think it's a really good time to take a break, but I just want to invite Ruth up from Senator Vitale's office. She is here today, and she's going to talk a little bit about the Anchor program, right? So.
Hello, everybody. My name is Ruth. I work for Senator Vitale, Speaker Coughlin, and Councilwoman Lopez. My coworker Sarai and I surroundedly do constituent services. We're here today. I have some information about the Anchor program. How many of you have heard of the Anchor program? That's great. How many of you have applied? That's even better. That's not everybody. So if you lived in New Jersey and you lived in New Jersey, you rented, you're a homeowner in 2020, and you made less than $150,000, you are eligible for some significant relief. And if you're over the age of 65, this year you're eligible for an extra $250. So the lowest amount that you probably would get if you were a renter and over the age of 65 would be around $700. If you are over the age of 65, the maximum amount of money you were able to get is around, I think $1,750. So Saranjali and I are in the back corner over there. The application takes 5 minutes. We need your social security number, income for 2020 or 2022, and your driver's license number. If you don't have that information today, we're more than happy to make an appointment with you at our office. We have all the information at our table. Okay.